I don't have to plan my life around transfusion appointments anymore. I didn't live my life. It was kind of just around a schedule. Hi, I'm Shruti. I was born in New Delhi, India. Now I live in Long Island. At the age of 11 months old, I was diagnosed with transfusion-dependent beta-thalassemia, and the doctors explained to my parents that I would need blood transfusions for the rest of my life. My mom's been the biggest supporter, my best friend. She's pretty much given up everything in her life to move here to New York and give me the life that I have now.
When she 11 months old, she born very healthy, but after 10 and a half months, suddenly she's have fever, she look very pale, and then we find out she have beta-thalassemia, and that's time I just think, oh my God, what happened to my daughter and my family? I just lost. I'm very lucky. I have only one child. She's the best daughter ever, and she's my best friend, and she and me have relation more than daughter and mother. And without her, I don't know how I live. And it's a blessing. I'm really blessed.
Since I needed transfusions every 1 to 2 weeks, depending on, my blood counts, getting blood in India was very difficult. Nothing really was consistent. You needed to find a donor to donate blood for you in order for you to get blood. So when I moved to Long Island, going to school, it was a big transition, especially moving to another country and not knowing the culture, the language, and what's trending, what music to listen to. So I was definitely bullied a lot. I was very timid and shy, but I found a creative outlet in makeup artistry. I always had to plan everything around my transfusion schedule. So as I was getting older, I wanted to have the ability to live without being held back by my health. So when I found out about CASGEVY, I was at my clinic and I was talking to my doctor. She mentioned that a facility was doing a clinical trial. I made the appointment with the facility. I went into the appointment very nervous. I didn't know anything about the science or the technology. They explained everything to me. I left still a little confused, but it was just too exciting to think that this was a possibility for me.
Indication. What is CASGEVY? Hexagamglogene autotemcel. CASGEVY is a one-time therapy used to treat people aged 12 years and older with beta-thalassemia who need regular blood transfusions. CASGEVY is made specifically for each patient using the patient's own edited blood stem cells and increases the production of a special type of hemoglobin called hemoglobin F, fetal hemoglobin, or HbF. Having more HbF increases overall hemoglobin levels and has been shown to improve the production and function of red blood cells. This can eliminate the need for regular blood transfusions in people with beta-thalassemia. Important safety information. What is the most important information I should know about CASGEVY? After treatment with CASGEVY, you will have fewer blood cells for a while until CASGEVY takes hold and grafts into your bone marrow. This includes low levels of platelets, cells that usually help the blood to clot, and white blood cells, cells that usually fight infections. Your doctor will monitor this and give you treatment as required. The doctor will tell you when blood cell levels return to safe levels. Tell your healthcare provider right away if you experience any of the following, which could be signs of low levels of platelet cells: severe headache, abnormal bruising, prolonged bleeding, bleeding without injury such as nosebleeds, bleeding from gums, blood in your urine, stool, or vomit, or coughing up blood. Tell your healthcare provider right away if you experience any of the following, which could be signs of low levels of white blood cells: fever, chills, infections. You may experience side effects associated with other medicines administered as part of the treatment regimen with CASGEVY. Talk to your physician regarding those possible side effects. Your healthcare provider may give you other medicines to treat your side effects. Please see additional important safety information at the end of this video and full prescribing information, including patient information at CASGEVY.com.
I met with the doctors. They explained what this treatment was going to be like. My doctors explained that undergoing the CASGEVY treatment journey would likely affect my ability to have children in the future. I decided to take steps to preserve my fertility. My biggest thing in my head was, I've made it this far. I didn't know anyone else that has gone through this, so I was definitely very nervous. At that point, I still didn't believe that this could happen for me, but then they cleared me for everything. So I did do this during COVID, which made it harder. I went to pretty much all my appointments by myself, but I was very excited when I found out that it was a green light, that I could come in for my cell collection. So I was admitted into the hospital for the cell collection procedure. The doctors explained that I would need blood transfusions. Getting blood transfusions, I knew I could do it with my eyes closed. I knew what to expect. I knew what I had to do, how long the days were gonna be. But this was all a first-time experience. Prior to doing the cell collection, they give you medication for your body to produce more cells. That was painful. I had extreme lower back pains. And then my cell collection started. I was there for a week. We ended up collecting more than what we needed, but I didn't have to go in for a second round. Sometimes you have to go in for a second round. So after I collected my cells, they told me that it would take a few months. And in the meantime, I was still getting my constant blood transfusions, and I was just waiting for them to call me and let me know that the cells were ready. So I was admitted into the hospital, very excited, very nervous. And they did tell me that I was gonna be there for a few weeks, and I've been in the hospital before many times in the past, but never for this period of time. I checked in, met all the staff. They started a PICC line on me, and then the following day, I started getting my chemotherapy. Chemo was no joke. I was really scared. I was really nervous. They were coming into my room every hour, doing blood work. I don't know what I was expecting. I thought I was gonna be sick right off the bat. Then going into third week is when I started getting all the side effects from the chemo. I had a lot of mouth sores. I felt really weak. I wasn't really taking my walks anymore. I couldn't swallow anything. I couldn't eat anything. I lost all my hair. I just woke up one day and brushed my hair and it was all in the sink. That was kind of scary. But I knew that was gonna happen, but obviously when it happens, you're just wow, this is scary. You could see my scalp, the hair was so thin, so I finally got it shaved. It was a very emotional day. I received my CASGEVY edited cells as a one-time infusion through an IV in my vein. My cells came in this refrigerator-looking thing. They told me it was gonna be very anticlimactic, and it was. It's a huge deal, but if you really in science, it was, they're pushing a syringe of cells. So it's not anything oh my God, but those were my cells. I had my mom come in that day. She spent the whole day with me. I had all my family in India on. My mom had my dad, because my dad lives in India. My best friend was watching, and then I got my cells. It was oh my God, it was really cool. Then after everything was done, I was okay, wow, I actually did this whole thing. It's not easy, being in the hospital for 5 weeks, but it's a mental thing. That you're doing all of this to get to an end goal, and this is not gonna last forever. I knew that this was all leading to something good for me. While I was in the hospital, I watched a lot of shows. I listened to a lot of music. I was able to talk to some friends and family. I think just having my best friend and my mom being there whenever they could be there were the push. It was helping me get through. When I was able to get like home cooked food, oh my God, those were the best days because I was able to eat something that I actually enjoyed. And then my friend had gifted me a toy cat. I named him CRISPR after like the science part of this. So CRISPR was there to give me company. And I think like that's what inspired me to get my own real cat, Bruno, my baby. The last week that I was there, I was just checked out. I was ready to go home. And the doctors like obviously needed to make sure I was stable enough to go home. They were looking for certain numbers that had to be at a certain point for me to get discharged. And the night before they told me I was getting discharged, I was like the happiest person ever. So after I was just discharged from the hospital, I had to go back every day to get my blood work done. They left the PICC line in case I needed like platelets or transfusion. And then I went back the following week. And then after that, it was every month I had to go, which then turned into every 3 months. I really appreciate the fact that I don't have to plan my life around a 2-week schedule because I have my independence. I don't depend on blood anymore.
My sacrifice is come true. It's really amazing thing we have. I have no words.
If you're eligible and you talk to your doctor and you're a good candidate and you can do it, I think that you should take the chance. Your journey starts here. Are you in?
Important safety information continued. How will I receive CASGEVY? Your healthcare provider will give you other medicines, including a conditioning medicine, as part of your treatment with CASGEVY. It's important to talk to your healthcare provider about the risks and benefits of all medicines involved in your treatment. After receiving the conditioning medicine, it may not be possible for you to become pregnant or father a child. You should discuss options for fertility preservation with your healthcare provider before treatment. Step 1. Before CASGEVY treatment, a doctor will give you mobilization medicines. This medicine moves blood stem cells from your bone marrow into the bloodstream. The blood stem cells are then collected in a machine that separates the different blood cells. This is called apheresis. This entire process may happen more than once. Each time, it can take up to 1 week. During this step, rescue cells are also collected and stored at the hospital. These are your existing blood stem cells and are kept untreated just in case there is a problem in the treatment process. If CASGEVY cannot be given after the conditioning medicine, or if the modified blood stem cells do not take hold and graft in the body, these rescue cells will be given back to you. If you are given rescue cells, you will not have any treatment benefit from CASGEVY. Step 2. After they are collected, your blood stem cells will be sent to the manufacturing site where they are used to make CASGEVY. It may take up to 6 months from the time your cells are collected to manufacture and test CASGEVY before it is sent back to your healthcare provider. Step 3. Shortly before your stem cell transplant, your healthcare provider will give you a conditioning medicine for a few days in hospital. This will prepare you for treatment by clearing cells from the bone marrow so they can be replaced with the modified cells in CASGEVY. After you are given this medicine, your blood cell levels will fall to very low levels. You will stay in the hospital for this step and remain in the hospital until after the infusion with CASGEVY. Step 4. 1 or more vials of CASGEVY will be given into a vein, intravenous infusion, over a short period of time. After the CASGEVY infusion, you will stay in hospital so that your healthcare provider can closely monitor your recovery. This can take 4 to 6 weeks, but times can vary. Your healthcare provider will decide when you can go home. What should I avoid after receiving CASGEVY? Do not donate blood, organs, tissues, or cells at any time in the future. What are the possible or reasonably likely side effects of CASGEVY? The most common side effects of CASGEVY include low levels of platelet cells, which may reduce the ability of blood to clot and may cause bleeding. Low levels of white blood cells, which may make you more susceptible to infection. Your healthcare provider will test your blood to check for low levels of blood cells, including platelets and white blood cells. Tell your healthcare provider right away if you get any of the following symptoms: fever, chills, infections, severe headache, abnormal bruising, prolonged bleeding, bleeding without injury such as nosebleeds, bleeding from gums, blood in your urine, stool, or vomit, or coughing up blood. These are not all the possible side effects of CASGEVY. Call your doctor for medical advice about side effects. You may report side effects to FDA at 1-800-FDA-1088. General information about the safe and effective use of CASGEVY. Talk to your healthcare provider about any health concerns. Please see full prescribing information, including patient information, available at CASGEVY.com.